Hey, Laura, so talk to us. What's one piece of advice you can give us this Monday morning?
You don't have to be an alcoholic to stop drinking.
Interesting. Can you expand a little bit more on that?
Yes, for sure. I was one who was the typical casual drinker through my life, conferences, events, mommy wine culture, growing up, the whole thing,
Hmm.
and couldn't see life without alcohol because I thought to stop drinking. First of all, I wouldn't have fun. Second of all, I had to hit rock bottom. Like didn't consider myself an alcoholic. And I think there's a lot of people who are in that same space that I was in, but I wasn't educated in this area. And so it's important for me to talk about this because I want to make a difference in dental because there's a lot of people who choose not to drink, who feel the pressure to drink alcohol and don't realize that you can choose not to drink and it's okay. We can normalize sober choices in our industry. So alcoholism is not a yes or no. It's a spectrum. And if we understand wherever you are on the spectrum, it's your decision what you want to do with your life, and it's everybody else's decision. And we need to stop peer pressuring each other
Hmm.
into the need to drink alcohol.
Interesting. So, on the spectrum here, where do you kind of see most in the industry as far as when it comes to like events and things like that?
Sure. Yeah. So, alcohol use disorder. If you've ever drank for the wrong reason, drank too much, or woke up in the morning and regretted drinking, you are on the spectrum because alcohol is an addictive substance and it doesn't usually serve us long term, right?
Hmm.
So if you ever regretted drinking at any point or drank for the wrong reason, you're on the spectrum. Now, where is everybody in our industry? All over. But the thing about alcohol is it is the number one self-prescribed way to celebrate or numb feelings or emotions. And it is the most standardized use of drugs that we use in our life. We celebrate with wine, we go out for champagne, we have beer tours, we go on wine tours, we go to conferences. It's all about alcohol. So it's so prevalent in our life that when somebody is questioning their use, their relationship with alcohol, or they're at events and they feel the pressure to drink, that's where it goes too far in the spectrum where we're really pushing in on each other. So in our industry specifically, we have an issue in the sense that we have lots of people who are licensed professionals who worry about their license, who have a lot of stress in their lives running practices, and alcohol is where we tend to lean when we're dealing with the hard stuff. And so, I would say for that regard, there's probably a few who are secretly having discussion in their head based off of what they have in their life.
What psychological barriers do you think prevent practice owners or dentists from admitting to or seeking help for alcohol use as a coping mechanism? And how can leaders effectively dismantle those barriers?
Yeah. So the number one reason is as a society for a long time, it's been something that you hide if you have concerns about your relationship with an addictive substance, with alcohol specifically. In the past, there was a stigma around if you were in recovery. It was real, but it's not like that anymore. Overcoming an addiction, especially with alcohol, it is a personal battle that many people do privately. And we're already shaming ourselves enough when you are like, I don't understand why other people can drink and don't have a problem, but I do. And it's already something you're beating yourself up about. And then as a society and in our industry and with people in our circle, there's the shame of like, what are people going to think about me? What are people going to question? And so it's just prevalent and everywhere. It's such a personal decision and conversation. And a lot has to do with the shame around it and the fear.
Okay. So then when it comes to that, especially when it comes to the burnout and stress, in your experience, how does unaddressed stress and burnout silently erode the culture and performance of a practice over time?
Oh, the fact that we can and we do go to other ways to forget about or numb the bad stuff doesn't have us deal with the actual issue at hand. So, stress, depression, suicidal thoughts,
Yeah.
all of the things that we deal with as humans, because at the end of the day, whether you're a dentist, a hygienist, or a receptionist, you're human. And if we are using a substance to numb the pain, what ultimately happens is we're not dealing with the true issue and we're not dealing with the real emotion. And because we're numbing the pain with a substance that is addictive, Everybody will get addicted to alcohol at one point or another. When do you get addicted? Depends on so many variables. But when we know that we're leaning into using the alcohol for the wrong reason and not actually dealing with the true stuff going on, that's when it becomes a problem.
What would be using alcohol for the right reason then?
Well, to be honest, I could sit on a soapbox now and tell you how alcohol is not good for us. But there are people who are in their head right now. They're like, oh gosh, Laura's reading my mind, right? Having a glass of champagne to celebrate a wedding, having one glass of wine with a friend once in a while. Alcohol it's been in our society forever. It's not going away. But if you start with one and now instead of one glass of wine, you're a bottle of wine. Instead of one glass of champagne, you did drinks before you went to the wedding and at the wedding, and then you're post-drinking. Like there's we all have stories, right? But research shows the first 20 minutes of alcohol is fun. The first 20 minutes of alcohol, you have the endorphins, you have the dopamine, it's great, but then your body suffers for the next 2 to 3 hours. If you're drinking for the 20 minutes and you recognize the next 2 to 3 hours and your body is recovering from every glass of alcohol that you have, right? So I could talk about where alcohol is not actually serving you, but if you're using it to numb the pain, if you're using it to get away from true emotions, then that's where I would question why you're drinking the alcohol.
Yeah, because I've always understood it in the sense of nutrition, right? Protein is, I think 1 gram is 4, carbs, 1 gram is 4, fats is 1 gram is 9 calories, right? But alcohol, 1 gram is 7, and our body doesn't utilize it, right? It doesn't need it for any building blocks or anything like that. So we're just literally poisoning our body to the sense of that. But now we're talking about the psychological part and mental health part, which is increasingly important. Now, when it comes to this, what are the long-term psychological and cultural implications, maybe in a practice that ignores mental health issues, particularly around burnout and alcohol use?
Not to get extreme, but we know suicide is a significant issue in our industry. Depression is a significant issue in our industry. And alcohol is usually tied to a lot of the problems that people have. And so when you're suffering, people have a glass of wine. When you're upset, let's have a drink. Let's meet over the bar and talk about it and have a drink. And so it's just that it's used so much and that it's pushed so much. It's just our societal norm to lean into alcohol. I mean, I went to the doctor recently and he's like, how much are you drinking before I stopped? And I told him what I was drinking. He's like, that's normal. That's not normal. Like we shouldn't normalize that alcohol is our friend. And so when it comes to the stress in the practice, the realities of what's going on, we need to recognize that that is an issue in itself. Working on the depression, the stress, the financial issues, your relationships, your whatever it is, if you're band-aiding it with alcohol and using that as the crutch to get through life, that is the problem. And the longer you do that, the higher chance you have of bigger problems in the long run.
Interesting. So then how do you ensure that discussions about alcohol use in the workplace go beyond surface level awareness and truly shift the mindset and behaviors of your team and leaders?
Yeah. My bandwagon, my thing I talk about is alcohol. Others, it's suicidal thoughts, it's depression, it's divorce, it's financial problems. Like we all have life things. We all have our own dark places, whatever it is. What we need to build and can build is an environment where people can just be okay with what they have. We know our own secrets. We know what's going on in our head. We know the things that have happened in our life, the things we've done. And we always compare the worst of us to the best of other people, right? The Instagram side of what other people are. If we could actually just build an environment, build a team where people can just have the space to be okay, to communicate their issue, to be allowed to feel. We are humans, no matter who's on your team, we all have real things going on. And if you can build a space that it's okay to be transparent, be vulnerable, and allow somebody to be able to talk about their thing, whatever it is. And so like for me with alcohol, my whole goal in this conversation is just to get people talking. Because if we can't get people talking, we're not going to help people. And so normalizing the okayness to talk about whatever your issue is, find people who have dealt with what you're dealing with and lean into that. Because the more we can fill the gap between people who need help and the people who can give help, by getting rid of that gap of shame and fear and allowing people to just be vulnerable and be real, will change lives and change your practice.
Yeah, I agree. Getting people to talk about it is huge, but then I feel like there's that fact of like vulnerability, especially if you're a leader. So, I guess in addressing alcohol use and burnout, how do you balance vulnerability and leadership strength, especially when you may be struggling with similar issues?
As a leader, your team is going to follow you if you set examples, right? So being vulnerable is a great leadership skill. To be able to say, I don't know. Now, I'm not saying that as a doctor, you need to tell everything going on in your private life and in your brain and all of the stress that you have, but to be vulnerable with your team, to say, I have some mental health issues. I have some personal concerns I'm dealing with. I have some things, and be real with your team. They're going to respect you and follow you that much more than trying to fake that you have it all together, because nobody has it all
Mhm.
together. And then going and getting the help that you need. Like, again, when you can lean into getting help, you can see how it improves in your life as a doctor and as a leader, and then be able to offer that to your team. Talk about turnover that we have. If your team knows that you really trust and believe in them and you're vulnerable and you're real and you care about them, they're not going anywhere. They're going to be
Mhm.
on your team forever. So just be real. It's all we really want.
Yeah. And so that shows strength.
Mhm.
Okay, I got you. So then in your work, Laura, how have you seen unresolved personal struggles with alcohol among dentists affect their ability to deliver patient care? And are there any interventions or what interventions have proven most effective in these situations?
Yeah, the reality is when I started this journey of sharing my story is a little bit easier than a dentist and a hygienist because I'm not licensed. So I can stand on the mountaintops and say, I'm happy to be sober and this is why I chose it for my life. But for a dentist, there's a real reality of your team, your license, your patients. And so the reality is there's a lot of licensed professionals in our industry struggling with mental health issues, struggling with addiction issues, and they're not getting the help they need. I actually have a hygienist that I'm affiliated with. She was more worried about losing her hygiene license than she was about getting a DUI when she was actively
Mm,
drinking, because that's her livelihood. Many team members, our dentists, we know that they're suffering, and that's our livelihood. If our dentist has to go to recovery or rehabilitation or take time out of the practice, what about our jobs, right? And so it's the reality of what's going on. Luckily, I've become really good friends with the incoming ADA president, Brett Kessler, Dr. Kessler, who that is what he wants to change for our industry, is to allow and have support for licensed professionals. They're bringing in a third-party company where you can actually call and get help. You can have real conversations, because our jobs are our jobs, but our life is way more important. Right. So I'm hoping that the worst cases that I know and the things I've seen, we can make a difference by just starting the conversation.
awesome, Laura. Thank you so much for your time. And if anyone has further questions, you can definitely find her on the Dental Marketer Society Facebook group, or where can they reach out to you directly?
Sober Life Rocks. That is our new community and group. Sober Life Rocks. Find me on all the social channels or just come to our website, Sober Life Rocks.
Awesome. So that's going to be in the show notes below. And Laura, thank you so much for being with me on this Monday morning episode.
Thank you.